Good afternoon, sir. Sir, am I audible, sir?
Yes, ma'am. Yes, ma'am.
Okay, sir. Good afternoon, all. Myself, Dr. Aisha Mullah. Welcome you all on today's session of webinar Pratigya 2020. First, I would like to wish happy Doctor's Day to all the doctors who have delivered the nice talk on our webinar. And I would like to wish all the future upcoming doctors, that is our student, a happy Doctor's Day. Our today's speaker is Dr. Nabhi Saab Kamatnoor. Sir has completed his UG from DGM Ayurved Medical College Gadag and PG from SDM College of Ayurved Hassan. Sir is presently working as Associate Professor in Department of Kaumarabhritya at Terdal. Sir has worked on an effect of Swarnamrita in growth and development in children. Sir has presented an article on effect of Bhumamlaki in Balatisar with special reference on viral diarrhea and got Best Paper Award at Pallava. Now I request Dr. Nabhi Saab to continue the session.
Thank you, madam. Very good afternoon, one and all. Wish you happy Doctor's Day to all. I'll take this opportunity to thank Ayurvedic Hubli Ayurveda Mahavidyalaya for giving me an opportunity to present in front of you, especially the team of Kamarabhritya, Dr. Sarita Madam and team for great initiation. The contents of my topic: the introduction, objective, principles of growth and development assessment for each age group. Introduction, the first point: the knowledge of pediatrics is very essential for every medical student or every medicos or those who are entering in the clinicals, because total around 42% of the population is below 18 year of the age group. 18 year of the age group is called as also childhood period. During the childhood period, the child is constantly attending growth and development. And during childhood period, child is it contains wide range of the age group like neonates, infant, toddler, preschool, school-going children. They have their own physiological, pharmacological, therapeutic values we need to remember whenever we are prescribing the medicine. Next, the field of pediatrics is dedicated to the optimizing the growth and development of the each child. Pediatrician should require the knowledge of normal growth, development, and behavior in order to effectively monitor the child progress. Growth and development is the essential feature that distinguishes child from the adult. The process of growth starts from the time of conception and continues until the child grows into fully mature adult. The growth and development, often the terminology used together, but they are not interchangeable because they represent two different facts of dynamic change. One is qualitative and another one for quantitative. Why we need to study the growth and development? In introduction only, I told that during the childhood stage, it contains wide range of the age group like infant, neonates, infant, toddler, preschool, school-going children. They have their own physiological, pharmacological, pathological, therapeutic values. We need to remember while whenever we are handling with the children. And the things are, the growth is a fundamental characteristics of the childhood development directly related with the maturation of the brain. Despite of being influenced by many factors, it remains remarkably predictable. Normal growth is indicator of optimal health. Deviation from the normal pattern is indicative of pathological process. Periodic assessment facilitate early detection of the growth altering, which may be the first manifestation of the infection or disease. And it's help to formulating the plan for kid, and it's also help to the educating the parents about the child condition. Next, move on to the definition of growth. Growth is defined as increase in the size of an individual due to increase in number and size of the cell, resulting in overall increase. I repeat, growth is defined as increase in the size of an individual due to increase in number and size of the cells, resulting in overall increase. Growth refers to the specific body changes and increase in the child size, height, weight, head circumference, and mid-arm circumference. This increase can be seen or it can be measured. Now, next move on to the development. It is a process of functional or physiological maturation of an individual. It is progressive increase in the skills and capacity to function. I'll repeat, the development, it is a process of functional and physiological maturation of the individual. It is a progressive increase in the skill and capacity to function. It includes physiological, emotional, and social changes. It is a qualitative aspect. It depends on the maturation and myelination of the nervous system is reflected in the sequential attainment of the development of the milestone. In simple words, growth is net increase in the individual size, and it is a quantitative aspect. When it comes to the development, this is the maturation of the function. This is a maturation of the function. It is a qualitative aspect. The factors affecting the growth and development. Growth and development depends on the variety of mutually interactive factors such as hereditary, biological, physical, and psychological, environmental, and emotional stimulation. They influence directly or indirectly by promoting or hindering the process. The main three factors like genetic factors, prenatal factors, and postnatal factors. In genetic factors like phenotype, parental characteristics, race, sex, maturation, genetic disorder like chromosomal abnormalities, genetic gene mutation. In prenatal, maternal malnutrition, multiple pregnancy, medical illness in the mother, drugs taken during the pregnancy, maternal infection, maternal endocrinal disorder, abnormal presentation, post maturity. In postnatal factors like neonatal hypoxia, neonatal convulsion, birth injuries, low birth weight babies, and other social factors. The social factors like family relationship, ethnicity, and religion, environmental factors like pollution, housing condition, educational status, all together along with age of the mother. The older the age of the mother, the chance of congenital anomalies. Nutrition, if child is getting adequate nutrition, he will be having normal growth and development. If he is not getting adequate nutrition, he will going to fall, he is going to alter the his growth and development. Repeated trauma, repeated infection, emotional factor like anxiety, lack of security, lack of emotional support and love, these all together directly or indirectly going to affect the child's growth and development. The principles of growth and development. Children is different. Children are differ in their growth. Some children are taller, some shorter. Difference are completely, these difference are completely normal. Some children will be taller, some are shorter because of these changes are completely normal. Children do not grow perfectly steady rates throughout the childhood period. They shows different growth and development. Development is a multi-directional. We come across changes in the during the principles during growth and development. We come across changes in mainly three domains. One is physical domain, cognitive domain, and third one is social and emotional domain. The physical domain includes in the changes in the height or weight or changes in the gross motor, fine motor skills or sensory capabilities. When it comes to the cognitive domain, it encompasses the changes in the intelligence of the child, perception or problem solving condition or memory or language of the child. When it comes to the social and emotional domain, also called as psychological domain, focuses on the changes in the emotion, self perception, and interpersonal relationship with the family and friends. The principles of growth and development. One is cephalocaudal direction, proximo-distal direction, and general to specific. All three domains influence each other. It is important to note that a changes in the one domain may affect and promote changes in the other domain. Cephalocaudal direction. Here, the child going to attain from head to toe. The first child attains structural and functional maturity at the head, followed with trunk, followed with toe. It is called as cephalocaudal direction. Second one is proximo-distal direction. Child here going to attain first proximal part. There is a structural and functional maturity at the proximal part, followed with distal part, or from midline to periphery or center to the periphery. Next is general to specific. Children use their cognitive and language skill to reason and solve the problems. Children are first able to hold the big things by using both their arms. In next part, able to hold the things single hands and only able to pick up small object like peas, cereals, etc. Then children able to hold pencil, first start draw the circles, then squares, then only letters after the words. Assessment of growth and development. Growth and assessment. First one is assessed by nutritional anthropometry, by assessment of tissue growth, by bone age, by dental age, and the growth studies with percentile. In nutritional anthropometry, weight, height, head circumference, chest circumference, these four things are age dependent factor. Mid-arm circumference is age independent factor. Before knowing the nutritional anthropometry, although world's children appear to follow similar growth pattern, still there are variation due to the ethnic, geographical, and regional factors, giving difference in velocity of growth and stature. IIP is recommended to IIP adopted the Agarwals at IIP Indian Academy of Pediatrics, adopted Agarwals at all 1992 and 94 growth chart for assess the Indian children's growth assessment. Parameters of nutritional anthropometry, age independent factors like weight, height, head circumference, chest circumference are age dependent factors. Age independent factors like mid-arm circumference, weight for height, mid upper arm and height ratio. First one is length or height. From height velocity at the time of Indian child average, they will be having length of the birth during the time of delivery, at the time of the birth weight, or at the time of newly delivered child is having average length of 50 centimeter. From birth to next 3 months, he is going to gain 3.5 centimeter per month. From 3 to 6 months, he is going to gain 2 centimeter per month. From 6 to 9 months, he is going to gain 1.5 centimeter per month. 9 to 12 months, he is going to gain 1.3 centimeter per month. Or in simpler way, at the birth, the length of the newly born child will be around newly born Indian child will be around average 50 centimeter. At the end of first year, he will having the length of 75 centimeter. At the age of 2 years, he will be having 87 centimeter, and at the age of 3 years, he will going to gain around 92 centimeter. How to measure the length, or when to take the length measurement or height measurement? Below 2 year of the age group, length is to be measured by using the infantometer. After the age of 2 year, stadiometer is to be used to measure the height of the baby. Techniques of the height measurement. While taking the measurement as stadiometer, the child should stand on the feet on flat floor, and his feet are parallel. His buttocks, shoulder, and occipital should touching the wall, and take the measurement of the child. I'm not going to tell the in detail about how to take anthropometrical measurement. I will tell only simple thing or basic thing, how when to take length measurement, when to take height measurement. At the below 2 year of the age group, you used to take length for measurement by using the infantometer. After the 2 year of the age group, stadiometer is to be used to measure the height of the baby. Body portions. The total body length is divided into two segments. The upper segment is from head to pubic symphysis, and lower segment from pubic symphysis to the toes. The upper and lower segment ratio is at the time of birth 1.7 is to 1 upper body segment and lower body segment. At the age of 6 to 7 years, both upper body segment and lower body segment is equal to 1 is to 1. Next and important anthropometrical measurement is weight. It is the commonest and important anthropometrical measurement. The weight of the child is nude or minimal. The weight of the child in the nude or minimal light clothing is recorded accurately in electronic type of the weighing scale. The special type of the weighing scales are used, which is addition to the weight of the individual along with his body mass, his or her body mass index. Weight. The common types weighing scales are beam type weighing scale or electronic type of the weighing scales. Growth velocity. The average birth weight for Indian infant 2.5 to 3 kg. Clear? From the 10th day to first 8 days, child is going to lose his birth weight. He is going to lose his weight for around 500 grams. From 10th day to 3 months, average child is going to gain 30 grams per day. From the day 10 to the first 3 months, from birth to first 3 months, child going to gain his weight from around 30 grams per day. From 3 to 6 months, he is going to gain 20 grams per day. From 6 to 9 months, he is going to gain 15 grams per day. From 9 to 12 months, he is going to gain around average of 12 grams per day. From 1 to 3 years, child is going to gain every year 3 kg. From 4 to 12 years, child is going to gain 2 kg per year. The weight average birth weight for Indian infants is around 2.5 to 3 kg. At the age of 3 months, child is doubles his birth weight. At the age of 1 year, he or she triples his birth weight. Around child will be weighing 9 kg. At the age of 2 years, child will be weighing around 12 kg. At the age of 3 years, child will be weighing 15 kg. At the age of 4 years, child weight will be around 17 kg. At the age of 5 years, child weight around 19 kg. Head circumference. Next important anthropometrical measurement, the size of the head circumference. The size of the head is a good indicator of its contents, the brain and the ventricle. It is measured with the non-stretchable tape passing through the maximum point of external occipital protuberance posteriorly and at the anterior glabellar point. The head circumference, expected head circumference in the children at the time of the birth, the average head circumference for Indian child or Indian neonates is around 34 to 35 centimeter. At the age of 2 months, child is going to gain 38 centimeter, and at the age of 3 months, he is going to reach around 40 centimeter. At the age of 6 months, a child will going to reach his head circumference 42 to 43 centimeter. At the end of first year, its head circumference will be around 45 to 46 centimeter. At the age of 2 years, its head circumference will be 47 to 48 centimeter. Next, under anthropometrical measurement, mid-arm circumference. How to measure? The upper arm circumference can be measured both in flexed and extended position, also either at the maximum circumference of the bicep muscles or midpoint. The difference between the two is negligible, which gives if the head circumference, if mid-arm circumference is more than 13.5 centimeter, it is coded with green color. If its head circumference is between 12.5 to 13.5 centimeter, is coded with yellow color, yellow. If head circumference is below 12 centimeter, it is marked with red. The above yellow and green color shows the normal nutrition, normal condition of the child. Below 12.5 centimeter is indicative of malnourishment, malnourished condition. Chest circumference. Under anthropometrical measurement, chest circumference. Chest circumference is measured at the levels of the nipple or midway between the inspiration, and expiration. At the birth, 3 centimeter, the head chest circumference is 3 centimeter lesser than the head circumference, and it will equal to the head circumference. At the chest circumference is become equal to the head circumference at the age of 1 year. Thereafter, it increased then head circumference. Age, these what we discussed: height, weight, and chest circumference, head circumference. These are age-dependent anthropometrical values. Next, we will discuss about the age-independent anthropometrical age-independent anthropometrical measurement. First one is mid-arm circumference. As the mid-arm circumference is relatively constant between 16.5 centimeter to 17.5 centimeter in first 5 years of the age group. This measurement may be considered as the age-independent variable up to 5 years of the age group. The mid-arm circumference first 5 years of the age group is constant between 16.5 to 17.5 centimeter. If a mid-arm circumference is less than 12.5 centimeter up to 5 years of the age group, is considered a malnourished condition. Next, weight for height. The degree of wasting can be measured by comparing the child's weight with the expected height for the healthy child. Combination of these measurements have been used to distinguish different types of malnutrition. In chronic malnutrition, the child is stunted with the weight for age and height for age. In chronic malnutrition, child his weight and height also below to the normal range. In acute type of malnutrition, height of the children will be normal, but weight will be below to the range for expected his age. In nutritional short stature, the weight and height will be equal. Quacker's mid-arm circumference is a measuring stick in height measuring rod, calibrated in mid-arm circumference and length. Values of 18% of mid-arm circumference for height are marked on the stick at corresponding height levels. If the child is found taller than his or her arm circumference levels on the stick, he may be considered as malnourished. Mid-arm or head circumference ratio. It's the simple and useful criteria for detection of the malnutrition. A ratio 0.28 to 0.31 indicates early malnutrition. The values the 0.25 to 0.27 moderate malnutrition. If values less than 0.24 is indicative of severe malnutrition. Under age-independent anthropometrical measurement, mid upper arm and height ratio. It is also very good indicator of nutritional status. A ratio of less than 0.29 indicates gross malnutrition, while normal ranges are 0.3 to 0.33. Next, an age-independent anthropometrical measurement, body mass index. This is a similar to Quetelet's index, except that the values are in SI units. BMI values can be used to draw standardized percentile curves in the children and adolescents. It is especially useful for defining obesity. If BMI greater than 85th percentile is a suggestive of overweight. If BMI is greater than 85th percentile is suggestive of overweight. If BMI is greater than 95th percentile is indicative of obesity. Next is ponderal index. Ponderal index is height in centimeter divided by cube root of body weight. This is another index similar to BMI, and it is often used in defining newborn with intrauterine growth retardation. Next is and next assessment with the next assessment of growth and development with the tissue growth. This measurement is done for the tissue growth measurement is to be done only special purpose. It is not used in routine clinical practice. It is measured with special caliber. The commonly measured the tissue growth taken values like tricep skin fold thickness, subscapular skin fold thickness, biceps skin fold thickness. Next, assessment with bone age. Bone age is useful in monitoring the growth in the children for condition like hypothyroidism or growth hormone deficiency. Comparison of the bone age with the chronological age is useful in diagnosis of the growth disorder. Principles of the bone age. Its first one is assessment is to be done time of appearance of ossification center. Next is epiphyseal or diphyseal union X-ray of the bone is to taken to assess the time of appearance of ossification centers and union. Next is dental age. Eruption of the teeth follows the definite sequence. That already primary dentition will appear after the age group of 6 months, and it will followed with there is appearance of the permanent teeth. Next is growth studies and percentile. While discussing the growth and various terms which are used must be understood. Cross-sectional study. This study is very convenient and easy, less time consuming and economical method to study growth. For example, children of each age group in large number are collected, their weight are recorded, and average found out. This group children study once. Linear or longitudinal study. It is a type of study. The same child is measured from birth to maturity at yearly or previously decided regular intervals. It is difficult to study large number of children. The linear study have comparatively less subject in number. Study helps to determine velocity of growth. Next is growth charts, also called a road to health chart, graphical display of the child physical growth and development. WHO charts recognize growth chart internationally. WHO chart has two references curve, whereas chart used in India are few references curve. Chart is different for girls and boys. This chart showing the weight for age, girls for birth up to the 5 years of the age group. Another example, weight for boys, weight for age for boys from birth to 5 years. Growth chart is the most important tool in assessment of the growth of an individual child. A standard chart contains weight for age, height for age, weight for height. The head circumference is included in first 3 years of the life. WHO aspected the National Centers of Health Statistics of USA chart as an international standard for growth for the first 3 years of the life. The growth of the healthy and well-nourished children is represented in these charts. Uses of growth charts for growth monitoring, diagnostic tools, planning or policy making, educational tools, a tool for action, evaluation, tool for teaching, a tool for information. This is about, in brief, about growth and growth. Now, in next session, Dr. Santosh Kati sir is going to deal about the development and milestone. In Ayurveda, there is a direct references regarding the growth and development is not available. Scattered references is available under the heading, under the various heading. Here we discuss the growth and development under the heading. Somewhere some people are discussing the growth and development under the heading of Samvardhana. And another point, Ayurveda describes the attainment of the growth and development through various sanskaras or ceremonies that are determinant for specific stages of the growth. Thank you. I'll thank to Dr. Sarita Madam and team of Komarvritya Ayurvedic Mahavidyalaya Hubli for giving me opportunity.
Thank you, sir.
Thank you,
I
madam.
request participant, if they are having any questions, they are free to ask. Sir, there is one question here. We all know continuous use of mobile phones, watching TV causes mental retardation, but is there any impact of these on physical development of baby?
These continuous use of mobile is going to affect his cognitive and social domain. Child is not going to affect. Please, hello, madam. Continuous uses of mobile is going to interfere with social interaction or lack social and emotional. Child is going to end up with some social and emotional related problem.
Thank you, sir. Sir, there is another question. Is there any particular Ayurveda formulation to increase the height of the baby?
The Bruhana line of treatment, we don't have such. We have many formula depend upon his how pediatrician, how the treating doctor approaching the child, how is the status of the condition of child. Based on many factors you can plan. If it's not, if you are restricting to one particular formula, it's very difficult. It depend upon the child condition, what type of the child status of the Agni you can plan with. We have many formulas.
I want to add on this. As such, there is no particular Ayurveda medicines to increase the height, but the nutrition aspect is very important. So we can use the Rasayana and Vajikarna Dravyas. And some of the Rasayanas are very much, they are very good, like Narsimha Rasayana, Bhargava Prokta Rasayana. They can be used And one more thing, the yogasana and pranayama, especially the yogasana like virasana, rukshasana, such kind of asanas and pranayama are helpful where you are suspecting there may be a growth and development problem in future. Otherwise, for height and all, usually other factors are also important, like mid parental height and their in familial trait and all we should see. It's not only the one concern, like if you give the medicine, if you give the food, the height will be reached. It's not like that. Environmental factors are included, genetic factors are included. So but we should all rule out first, then we should go for the approach. And there is one more question in the chat that of course there is a next session on milestone. Please be please stay tuned.
Thank you, sir. Thank you very much.
Thank you, madam.
Is there any questions to ask to the Nabhi sir? From the participant or in YouTube, students can ask the question regarding the growth and development to Nabhi sir. If any questions are there, you can put in the chat or in YouTube. We will move on to the next session. Thank you, sir. Nabhi sir, for your wonderful and knowledgeable presentation. Thank you. Thank you from our Komarbhata department and from Ayurveda Mahavidyalaya Hubballi. Thank you so
Thank you,
much,
ma'am.
sir.
Thank you all.
Now we are moving to the next session. That is, the next session is on milestone during infancy and childhood. And the next presenter is Dr. Santosh Katti sir. And sir has completed BMS from SGV Ayurveda Medical College, Bailongal, and obtained Komarabhrita PG from STM College of Ayurveda, KLA, Belgaum College, Kahir University. Sir chaired many national and international seminars, presented paper in an international seminar and presented article in a national journal. And sir is a chief pediatrician in Bala Sanjivani Chikitsalaya at Itgi Cross. At presently, sir is working as associate professor in Shribi Guttal College, Ayurveda Medical College, Dharwad. Santosh sir, the session is over to you. Nabhi
Thank
sir,
you.
you stop the sharing, sir. Nabhi sir.
Thank you very much. Shall I start, madam?
Yes, sir. Yes, sir.
Okay, fine. Okay. Thank you, Sarta madam and the Ayurveda Mahavidyalaya Hubli College Management and the principal, sir, giving an opportunity to share my views on developmental milestones. It's not exactly my views because already this all the things are were researched one. Am I audible to everyone, sir? Everyone, madam?
Yes, sir. Yes, sir. You are audible, sir.
Okay, madam. Thank you. Wait, I will going to share one PPT here. Wait to share. Share screen. Madam, this PPT is visible to you?
No, sir.
Slides are not visible, sir.
Hello, this is not visible, madam.
The screen is not yet visible, sir. Your photo is only coming, sir.
Shall I leave the meeting and again? Can I join it again, ma'am?
Yes, sir. Yes, sir. Yes, sir. You can rejoin, sir.
Okay, ma'am. Thank you, ma'am. Thank you.
नहीं गए बस हमने नीचे गए अभी गए नो एंडिंग का भी आवाज आ रहा था
Hello, madam. Now is it visible? Hello.
Hello, sir. It's not visible.
I will do one thing, madam. Then I will send the PPT to you in your WhatsApp.
No,
Just
wait, sir. Wait, sir. I will make you as a host. Then you can.
okay, madam. Okay.
Okay, sir. Sir, now I have made you as a host. You can share now, sir. You try now once.
Okay. It's not visible, madam. No, I shared that one.
So still it is not coming, sir.
I'm sending you PPT, madam. You just share to that one, madam.
Okay, sir. Okay, sir.
Okay. That.
You are mail doing by mail or WhatsApp, sir?
By WhatsApp, I am sending you, madam.
Okay, sir. Okay, sir.
Madam, I sent you.
Okay, sir. I am checking one. Just 1 minute, sir. I'm downloading it. So now you are able to see the screen, sir?
Yeah, madam, I can see.
Yes, sir.
Okay, madam.
Wait a minute,
First,
sir. I'll just maximize it. Okay, sir. You can present, sir.
okay, thank you, madam. Good evening, everyone. So today's my given topic is next slide, madam, please.
Wait, sir. Wait a minute, sir.
Okay. Today's my given topic is developmental milestones of infant and child. Okay, I'm going to deal with only developmental milestones of infant and child in modern aspect. Okay, fine. So is here while when we'll study the developmental milestones of infant and child. So when we'll study in the modern aspect, there is no nothing much to do there. So what is development exactly? Before we studying about the milestones, we'll study about what is development. Okay, child development refers to how a child becomes able to do more complex things as they get older. It's not like the simple things, more complex things as they get older. Development is different than the growth. Already, as my friend Nabhi sir has talked about the growth. Growth only refers to the child getting bigger in size rather than the development. And development is a continuous process from conception to maturity. Okay. One more thing is the sequence of development is identical in all children. Yes, but the rate of development varies from child to child. Okay. Next, madam. Next.
Yes, sir.
Next, when we'll go for the definition of this development specifies maturation of functions. It means that it is related to the maturation and the myelination of nervous system and indicates acquisition of variety of skills, optimum functioning of the individual. It's the optimum functioning of the individual, not the things. Next, ma'am. So we'll divide the developmental skills into 5 types. Under 5 types: gross motor development, fine motor development, language development, cognitive development. We can think in terms of thinking skills and the social. Now we'll study what is gross motor development. Gross motor development is using a large group of muscles. Here, we are using a large group of muscles. We are not using a small muscles here. Big muscles we are using. Okay. So to sit like that, to sit, to stand, walk, run, etc. Here we are keeping the baby is going to keep the balance and it's going to change the position here. In case of fine motor, using hands to able to eat, draw any diagrams, wearing the dress, playing with the toys, writing the anything, and do many other things which needs some skills here. Actually, fine motor needs some skills which requires a small minute things here. Language, here language always will think about the language in terms of the vocal words, vocal language. Madam, your PPT is not visible.
Wait a second. I stopped the video. Maybe the reason. Wait. Sorry, sir.
Okay. Language always we will think in terms of the vocal words. Here language not only about the speaking, here using the body language also. Sometimes the child can't able to talk, speak, then with the help of some gestures they can able to understand, and this is a communicating, understanding what others say. This all will come under the language. Cognitive, as I said, is nothing but thinking, including learning, understanding, problem solving, reasoning, and remembering. Social, next the social development is interacting with the others, having relationship with the family, friends, and teachers, cooperating and responding to the feeling of the others. Here, in this topic, I will mainly cover about the gross motor and the fine motor. I'm not going to cover much about the language, cognitive, and social. Okay, because these are very much important for our practice and for the parents also. Next, madam. Okay. One more thing is developmental milestones are guides. They are not set in a stone path. See, these are the guidelines. They are not set in a stone path. Suppose think that the Ayurveda Mahavidyalaya in Hubli is this much far away from the Hubli new bus stand or Hubli this much. That's not going to change. But these are the guidelines. In developmental milestone, when you take about the developmental milestone, they will become the guidelines. They are not going to become the step stone path. They are not. It's not like that. Every child will reach the developmental milestone that this age only, this kilometer. So if you travel for 5 or 7 kilometers, you are going to reach the whole bus. It's not like that for every child. Okay. During the first few years of children's lives, they have so many skills to acquire. Skills such as talking, sitting up, walking, or developmental milestones. Developmental milestones can be used as a guidelines to know when the child should be performing certain skills. Okay, these are guidelines to know when the child should be performing certain skills. However, these milestones often happen at a wide range of times and are not set in a stone. This one should be kept in mind. Next. Children are trying to learn so many new skills at the same time. So if another child is working and your child is not working, suppose think that the parents will come, sir, that child is working, our child is not working. It does not always mean that your child is experiencing developmental delay. Remember, suppose think that some child will start working at the age of 10th month also, and some child will start working at the age of 18 months. It doesn't mean that child has the child which has start working at the age of 18 months, that child is not having any developmental delay. Okay, if parents are concerned, suppose think that okay, our child might be having delay, then what they need to do is they need to consult their own pediatrician or the teacher. Suppose think that this is a commonest problem what we'll face in the when we'll go for the practice. Many parents will come, our child is not scoring much, but our neighbor child who is in the same class is scoring more, but they are playing same thing. They are spending the same time. That time you need to consult teachers or any intervention centers where you need to get the treatment for that one. You need to get evaluated. This is for the parents. You need to convince them. Second, next, madam. Achieving milestone is not always a sorry, madam. Before one. Okay, previous one. Achieving milestone is not always a smooth sailing. It's not like that you are sailing very smoothly on the water. Child mastered a skill and seemed to have lost it for a little while. There was a period of a time when your child was so cranky that she or he drove you crazy. Sometimes you suppose think that many parents will tell, show your nose to when your guest will come to your home, they will ask, show your nose. And that at that time when your child will show the nose to that your neighbor, you'll become very much crazy. See how our child has mastered, are very much skilled, very much talented. Okay, these are common for a lot of families we will see. Next is, why do this happen? Why do these things happen? When children are mastering new skills, their brains are telling them to keep pushing. Whenever they will achieve something, okay, that time the child brain are telling them to keep pushing. When their brain is so alert and focused on achieving a new mind.
I request all the participants, please mute yourself.
With their brain so alert and focused on achieving a new milestone, children sometimes experience difficulties staying asleep. In the night time also, they want to practice. They want to go for a walk. Okay, might even regress for a short period of time. These are all normal behaviors, and child should go back to family routine soon after child masters the skills that child has been working on. Next, here we'll come to the child developmental table. How we'll do the child developmental? Here we are in the so many age classification, like infancy period is there, toddlerhood is there, preschool is there, school is there, early adolescence is there, middle adolescence is there, late adolescence is there. Infancy means from birth to 1 year. Toddler means all we are studying about this one, all we are knowing. Next, one more thing, whenever when you will meet the parents in future, when you will go for a practice, okay, that time many parents will bring their child. Then you need to convince them, your child's milestones are your child's stories. You need to tell them milestone can be stressful because it is easy to compare your child to another child. because that child is walking. That might be normal for us, but when our child is not able to walk, that will be more difficult for to that child. But child development is not a race. Remember it always. You should not compare our child to another child. Okay, within an appropriate range, it's normal that child might be faster or slower to learn certain skills. Parents will often see a big difference even among siblings. This is very much commonest and biggest issue for the practitioner when you go for the practice. So instead of comparing your child's development to others, let's think about it as his first life story. Then you can explain them. Okay, what are the signs of your child's getting ready to walk before he took the first step? Maybe there was a lot of falling and afraid of standing on his knee. This story you can tell to your kid. That will be the bigger story for them. Okay, this way you can convince them. Next, so gross motor milestones. So what is gross motor milestone? Using the large muscles. In first month, what will happen? Chin up in prone position, turn sides in supine position. So I will tell how to remember all these things. Okay, because we can read these things even in the book, even in the PPT, even in the net, everything is normal. But how to remember these things is important. In second month, chest up in prone position, head bobs when held in a sitting position. When you hold the baby in the hand, then head will falls up. There's a head bobs will occur. Third month, props are on forearms in prone position, rolls to sides and rolls to side. Fourth month, sit with the trunk support. When you'll make at the age of fourth month, when you'll be, keep the baby with the when you'll make the baby to sit with the support that can able to sit. Head lag sometimes, but neck holding will be achieved at this age. Fifth month, sit with pelvic supports and rolls back to front. Put arms out front when falling. Sits with arms and supporting trunk. See, what you need to do is you just draw a line. Okay, you make a picture of the baby like one. First make a head and one neck with a single line neck, arms and the single line body, and two legs with the two lines. What you need to do is you just draw a line over the neck, that's the third month, and just draw a line on the abdomen, that's the sixth month, and just draw a line on the knees, that's the ninth month, and draw a line on the foot region, that will become the 12th month. How to remember these things? At least when you fail to remember all these things, at least we can remember the some developmental signs. The line which will drawn on the neck region, that will be neck holding, that's the third month. Okay, when you will draw a line on the abdomen, that will become a 6. Okay, that will become the baby can prone to supine position. Okay, supine to prone position, they can roll to sides. Okay, when you draw on the line on the knees, that will become the 9th month. By that time, the baby can able to crawling will be comes. And when you will draw a line on the feet region, that will become the 12th month. The baby can able to stand and walk. Okay, this way you can remember. 6th month, sit momentarily propped up on hands, points in prones. In prone position, bears weight on one hand. With one hand, the child can able to bear the weight. 7th month, bounces when held, sits without support steadily. Lateral protection locker, puts arms out to side for the balance. 8th month, gets into sitting position. Command crawls, pulls to sitting, kneeling position. 9th month, stands on feet. This is not possible exactly. We will get in with us so many different reference will tell that, different research will tell like that. But 9th or 12th month, the baby can able to stand. Okay, begins creeping, pulls to stand, bear walks. 10th month, creeps well. So cruises around the furniture using two hands. Here, when you will make the child to stand on the furniture, on the sofa set and all, with the two hands they can able to cruises. Okay, stand with one hand held, walks with two hands held. Okay, they can able to stand with holding the one hand. With the help of two hands, they can able to walk. In the 11th month, with only the one hand, they can able to walk. Okay, 12th month, they can able to stand well with arms high, leg space, posterior protection, independent steps. They can be able to put a 1 or 2 independent steps. Okay. When you'll study about the fakkaroga, I don't want to discuss about that fakkaroga. Next, madam.
Sir, ಇದರಲ್ಲಿ ಇಷ್ಟೇ ಅನ್ಸುತ್ತೆ slide.
ಇನ್ನೊಂದು ಕ್ವೆಶ್ಚನ್ ಅನ್ಸುತ್ತೆ ಮೇಡಮ್, ನಾನು ಇನ್ನೊಂದು ಕಳಿಸ್ತೀನಿ ರೀ. Wait, madam, I'm sending one more thing.
Only 14 slides are there, sir. In my
ಇಲ್ಲ ಮೇಡಮ್, ಇನ್ನೊಂದಿದೆ. I will send that one also.
Okay, sir. Okay. Shall I close this one, sir?
ಇಲ್ಲ ಮೇಡಮ್, ನಾನು ಕಳಿಸ್ಬಿಡ್ತೇನೆ ಇವಾಗ.
No, I'll close this slide.
Okay, madam, you can close that one where I went. ಇನ್ನೊಂದು ಸೆಂಡ್ ಮಾಡ್ತಾ ಇದ್ದೇನೆ ಮೇಡಮ್ ನಾನು.
Santosh sir, did you send, sir?
Yeah, ma'am, I'm sending. Sorry for the delay, madam.
So till Santosh sir sending the another PPT, there is one more question in the YouTube that what is the treatment for mental retardation in YouTube? In Ayurveda, like that. One more question in the YouTube they have asked from anybody from the participant. Especially, I request this question to the Pushottam sir. What we can do for the mental retardation in Ayurveda?
Hello.
Hello, sir.
Am I audible, madam?
Yes, sir. You are audible, sir.
Okay. Thank you for giving an opportunity. The thing is, when you're talking about the mental retardation, you should be aware that what is the mental retardation. Okay. When the question is treatment for mental retardation according to Ayurveda. Okay. So, shall I continue?
Yes, sir. Yes, sir. Sir, still there. Sir has not sent. You can continue, sir.
Okay. So the thing is, there are two. You can think in the two line of the treatment. The one thing is we can go for like a medicine aspect. Another thing is we have to go for sensory like stimulation aspects. Okay. So mental retardation, we have to assess the mental retardation, and then we have to plan that in which area the child is lagging behind. Okay. And based on that, we have to stimulate that area, and we have to make the child, or we have to help the child to come up with mental retardation. See, the only one thing is we can't come up with only the medications which will be going to help for the child coming out of mental retardation. Okay, mental retardation, it's a condition, that's it. Okay, its intellectual function is not age appropriate. What's the point? So don't think that the only medication will be going to help the mental treating the mental retardation. Okay, and for the kind information, recently they have removed this mental retardation. So they nowhere nobody people they are saying about the word mental retardation. It is intellectual disability. Okay, so I request all the students that keep in mind that don't use the terminology mental retardation. Okay.
Madam, I sent you.
Yes, sir. I am sharing, sir. There is one more question from the student that we'll take at the end. Now I will continue with the session with Katti, sir. Wait a minute, sir. This is the next one, no, sir?
Yeah, madam. Fine motor.
Yes. Continue, sir.
Okay. Hand regard is seen.
Thank you, Purushottam sir, for sharing the knowledge to the students. Thank you, sir.
Thank you, ma'am.
Okay. Hand regard is seen in babies between 3 to 5 months of age. It occurs when baby is seen lying supine, watching the movement of the hands. Persistent beyond, this will be persistent beyond the 5 months also. So, how to remember this one? See, abnormal mnemonic. In hands, there are 5 fingers, and persistence beyond the 5 months is abnormal. Suppose think that. So, how to remember hand regards is seen in babies? When you will put something in the hand of the baby, they is to grasp it. Okay. If they are grasping even beyond the 5 months, then that will be normal. You need to consider. How to remember? Because the baby's hands is having 5 fingers. After 5 fingers, if they are after 5 months, if they are holding that one, that will be normal, abnormal. You can consider it. Next, bidextrous approach, approaching towards object by both the hands. Okay, that will be seen 4 to 5 months. 4 to 5 months, unidextrous approach. Okay, approaching towards the object by hands. 5 to 6 months, ulnar grasp, holding things in ulnar medial side. I'll show the picture of that one. Side of the palm. 6 to 7 months, radial grasp. Okay, holding things in the radial side of the palms. That you can see in the 7 to 9 months. And immature pincer grasp, partially holding pen between the index thumb. That can be seen in the 9 to 10 months. Mature pincer grasp. We can see the picture, then you'll understand. Here, this will be a pincer grasp. Okay, with the 2 fingers, the child can able to. Next, ma'am. With the 2 fingers, the child can able to hold it. Unidextrous approach. Okay, see here with a single approaching towards object by both the hands. That's the unidextrous approach. Both the hands, you can see. Radial grasp with the help of the thumb and the 2 fingers, the child can able to hold. Ulnar grasp with the little fingers and the ring finger, that child can able to hold. Here, how to remember is ulnar means medial, which has lost 6 letters. Okay, that is a 6 months. Okay, you can see medial. Ulnar is the medial, no? So medial. MEDIAL. Okay, radial means the lateral. Okay, which is having the 7. Okay, that will last for 7 months. Unidextrous, 6 means 3 letters multiply into 2. That's a 6 months. Bidextrous by 2 letters. That's a 22 letters. That's the 4. By this is a one way of remembering the milestone. That's it. Next, 6 to 12 months. Here, the child can able to stand, crawl, sit, stand, and walk. 1 to 3 years. Next one. Making towers of 2 cubes. This will be achieved by 13 to 15 months. Making towers of 6 cubes by the age of 24 months. Making towers of 10 cubes, that's the 36 months. Turns 2 to 3 pages simultaneously. See, when you ask the patient, the child to turn the pages, they can able to turn the pages. Many pages they will take and they will turn it at the age of 18 months. Turn each page separately by the age of 2 years. When you ask them to turn, they used to see the picture of individual page by turning single page by the age of 2 years. Cup without spilling, they used to hold the cup without spilling, that's the age of 15 months. Okay, sorry, with spilling. Spoon without spilling, 18 months. Copies line. Okay, they can able to copy the lines by the age of 2 years. And when you ask the child to draw a circle, they can able to draw a circle at the age of 3 years. They can able to draw the scribbles at the age of 15 months. 13 to 15 months, walking without support. Okay, 15 months, creeps on stairs. 18 months, they can able to run. 2 years, walking backwards, walking on stairs on one by one. here the scribbling you can see here. That's the towers. They can able to make a towers. I didn't mention that picture of that one. And this one I mentioned. You can see copies line walking with creeps on stair. 15 months the child is creeping on the stair. They can able to walk, run by the age of 18 months. Creeping means they can do some gas things. Next man. Next man. Okay. So this chart will tell you about the all the fine motor, gross motor, okay, language and everything. Here, madam, in zoom ಮಾಡಕ್ಕಾಗತ್ತೇನ್ರಿ?
ಇಲ್ಲ ಸರ್, mostly it's not possible, sir.
Possible ಆಗಲ್ಲ.
No, sir.
Ask them to download. Okay. See, only thing here you need to remember the social, language and others. In social, at the age of 1 month, androgenous smile will be there. Okay, that will be continued for the 2 months. And preferential social smile, that is of 4 months. Preferential social smile means when the mother will come, when the very nearer people will come, they can able to give the smile. When the strangers are there, they won't give the smile. At the age of 6 months, they will get the stranger anxiety. If someone is taking the baby, they won't go to other person, unknown person. That's the stranger scale. By the age of 1 year, separation anxiety, they don't want to live by their parents. Okay, depends on the parental figure. They always want to stay with the parents. And by the age of 2 years, there will be selfish and self-centered. Okay, and imitates the mannerisms. Suppose father is scolding, father is doing something. If they are keeping the something over there, they will used to go and keep there. They used to imitate. And at the age of 3 years, they can go for the group play and fix gender identity. They want to mix with the male child, and some they want to mix with the female child. Okay, this is a sex specific play, you can say. And they used to understand the taking turns, and they used to understand their sex. By the age of 4 years, initiation of adult roles. Okay, curiously about the sex, playing as the doctor. And they used to have the nightmares. They used to get fear with some dreams. They used to get the dreams, and they used to get fear for that one at the age of 4 years. At the age of 5 years, okay, conformity to peers in important and romantic feeling for the others. Suppose think that they used to have the romantic feeling for the others at the age of 5 years. And at the age of 6 to 12 years, is not comes in our topic. When you come to the language, at the age of 4th month, they laugh aloud. Okay, sorry. At the age of 1 year, they can able to use the around 10 words. There are monosyllables and bisyllables there. Usually they used to come the pa, ma, like that. They will start, and they will go with the bisyllables. At the age of 12 months, they can able to tell the 2 words. And at the age of 2 years, they can able to pronounce, and the parents can understand their language. And telegraphic sentences they can use. 2 word sentences they can use. They can able to use maximally 250 words at the age of 2 years. At the age of 3 years, complete sentence they can able to use around 900 words, but understanding for that one. And even the strangers can also understand the language, recognize the common objects in the pictures. At the age of 4 years, they can able to tell the stories of the cock something and bull stories, and the use the precautions, etc. This about the language development. This completes our developmental milestones. Here, only thing what you need to consider is gross motor development as per your practice, because most of the parents will come with a complaining of our child is not walking, our child is not talking. Only walking and talking with the complaints they will come. Please concentrate on this one. As per the exam point, just concentrate on the. There are 4 types of 5 categories will do: gross motor, fine motor, language, and the social. And the cognitive one is there. Okay, depends on these things. You can go for this one. Thank you. If you are having any doubts, you can go with, you can ask. Thank you, madam.
Thank you, sir, for your nice presentation. And it was, I hope it is very useful to the UG students. The participants are free to ask the questions if they have any doubt. From the earlier session, the one participant has the doubt that how to identify the mental retardation. So usually in future session, we have the talk on mental retardation. That will become very clear. Sir, in short, you can answer the mental retardation. How to identify the mental retardation in child?
Is this question for me, ma'am?
Yes, sir. Yes, sir.
Okay. We need to go for the IQ test. Okay. So many methods are there to test those IQs. I think those portions are there. In next sessions we will learn about that one. As a stretch, as per the developmental milestone, when you see the child, see, it's very difficult to identify the child till at the age of 6 months. The baby is mental retarded or what? Suppose think that the baby is not at all laughing even after the age of 4th month or 7th month and all, then you can go over some. There might be some developmental delay. Okay, there might be some mental retardation. They will act very irrelevantly towards your when you give some action to them. They won't react to you properly. That can be done very easily. Some IQ tests are there. They depends on the age. Okay, some tables are there. Some instruments are there. With the help of that, you can assess the child for mental retardation. It's very different in early infancy period.
Okay, thank you, sir. Any questions, students? Regarding growth and development and the milestones?
Hello, madam.
Yes, sir.
Just I want to add something for this.
Yes, sir.
The one thing the sir was talking about, like we can't assess before like 6 months of the age, mental retardation and all the thing. I want to add something for that.
Sir, sorry.
So the thing is, first of all, the thing is mental retardation. The concept is now it has been removed from the all the things. Okay. Now they are using the global developmental delay or developmental delay. That is the first thing. And the second point is mental retardation. We can assess through all this tests, whatever we know that the scales and available in the like Sibgin Forum board or like draw a man test. Okay. But before 6 months of age or before 1 year of age, we can assess them with the help of the developmental quotient. Okay. Like we have a DASI. I think you are familiar with DASI and all the thing. Okay.
Yes, sir.
So DASI we can assess in DASI test. We can assess all the areas like what we were talking about, the gross motor, fine motor, cognitive and everything. Okay. So that is the better thing that we can't say that we can't assess before the age of 6 months or 1 year like that. So better it is the thing is we can assess those things.
Okay, sir. I might have said it's difficult to assess, I think. Sir. Okay. Thank you, sir. Thank you.
Okay, thank you.
Sir, Pushottam, sir, please explain the DASI scale because so many UG students, they won't understand what is meant by DASI.
DASI means it's a scale developed by development of it's a modified scale development assessment for Indian infants. Like they have made a scale. If you want like regarding the DASI, you'll get it in the Google, everything, all the matter. It's a scale which contains all the domains and it has certain items. Okay. So those items should be checked with the infant or the baby, whether the child is going to pass for that item. Okay. For example, as sir was explaining like grasp and all the thing. Okay. And the neck holding, gross motor and all the thing. So the thing is, if the child passes that item, then you have to put a mark. If the child is not going to pass that one, we are not going to mark that item. So it's a total score which will going to give the like whether the child is globally developmental delay, or in a particular the area has been delayed. So it's a just scale. For the UG point of view, I request all the students that be aware that there is a scale DASI for Indian infants. Okay, the modified like in for like American standardized, they are using Bailey's. You have heard about the word like Bailey's infant developmental scale, so which they are using in the international things. So in Indian babies, we are using the DASI. So that is the only one thing. It's a scale used for the assessment for the Indian infants for the growth and development. That is the only one thing, madam.
Sir, one more thing I want to add here is DASI scale can be applied only from the age of after the age of 3 months, sir.
Yeah.
3 to 2.5 years, not before the age of 3 months. It's not
Yes.
possible to assess the DASI scale or apply the DASI scale before the age of 3 months.
Okay.
Okay, sir. Thank you.
Okay, sir. Thank you so much. Just I want to give an idea about the DASI scale for all the UG students. That is my intention. And is there any questions from the participant side? I think there are no questions. And I thank to the Dr. Santosh Katti for his very knowledgeable presentation, and also Purushottam sir for adding the some regarding points regarding the mental retardation and all. And the first presenter, Dr. Nabhi sir. Thank you so much, sir. You have presented in a very that students they can understand very easily. Nicely you have presented, sir. Thank you so much, sir.
Thank you, madam.
Now I am going to conclude the session. Thank you one and all.
Thank you, madam. Thank you for giving the opportunity. Thank you, madam.
Santosh sir, you
Shall we end the meeting,
yes,
madam?
sir, you only end, sir, because